think she's smiling because ain't shit funny, but why is she smiling, y'all? What is going on with her looking like it's all groupy? Well, why is she smiling? What do you think? She has no symptoms. She's in kidney failure, but she has no idea. So she's still smiling. That's what you better remember about this page. It's a very gradual process. Chronic kidney disease, CKD. Chronic kidney failure, very gradual. 10, 15, 20 years, gradual. Some of you may be sitting here with it and don't know it. I've diagnosed in the room before people that are having signs of early kidney failure. Just education, so powerful. Just knowing your shit can save your kidneys and your family's kidneys. So let's look at this lady because she's looking way too happy. We have lots of wonderful things on the page. Number one, pay attention to the words at the top. Alternative language for CKD is diminished renal reserve when you're only in stage 1 or 2. This patient is early. Stage 1 or 2 is simply diminished renal reserve. If we play our cards right, she can save her kidneys, and this will never be a cause in her death. But we gotta catch her here. Now, let's look at glomerular filtration rate. Let's make sure we know all of us in this room should have a glomerular filtration rate between 100 and 125. So far, so good? All of us in this room should have a glomerular filtration rate between 100 and 125. She still has a fairly decent rate. It's around 90 or a little bit higher. So she doesn't know anything is going on so far, right? She doesn't know. Now, we need to remember facts. We need to remember that as you get older, especially 65 and older, your glomerular filtration rate drops naturally. That's why we had a conversation in class the other day about Joan Rivers. She was 73 years old. She was tiny. She's at the getting surgery done. We had to remember as nurses, her dosaging might have needed to be cut in half because she can't clear drugs out of her system. So when you look at someone that tiny and that old, you need to remember the dosaging that you're giving this patient may needed to have been cut in half because they don't have the greatest glomerular filtration rate and therefore they can't clear those drugs. And they stay in the body and become toxic, fatal. Okay? Now, if you look a little bit longer, go down to the next one. It says observation and control of blood pressure. You knew that. You knew that the number one cause of chronic kidney failure is hypertension uncontrolled. The problem with hypertension, it's silent. Silent but deadly, my big mama used to say. Because you ain't walking around thinking, oh Lord, my blood pressure high. You don't know it first. You don't know it first, right? So it's silent but deadly. Now let me help you with this. Use that little area to put the top 3 reasons why people's kidneys fail and they end up on dialysis. Number 1, always tied with number 2, tied. Uncontrolled hypertension is tied with diabetes. Those are the reasons why people get dialysis and kidney failure. Number 3, something you don't think about as much, who knows what it is? Which one of you guys know? You might know. Darnita, what is it? 3rd reason for dialysis. Lupus. Excellent. Lupus is the 3rd reason. Most people don't know that. In fact, the number 1 cause of death for the lupus patient is kidney failure. Okay, so you better know your shit here. Okay, keep it moving. We down at the 24-hour urine for creatinine clearance to detect loss of renal reserve. What do we do with the 24-hour urine? What is the first step with your 24-hour urine, Janae?
When you wake up in the morning, you use the bathroom and flush it.
Excellent. When you wake up in the morning, you time the bottle for when you woke up and you go pee and flush that sample. You know why you flushed it? That was yesterday's urine. You peed it today, but that was from last night. Okay, now you set the timer, right? So you put the time on the bottle. Let's say that you woke up at 6 a.m. Boom, that's when it starts. Now, you gotta keep it cool throughout the day. Tomorrow, when you wake up at 6, you use that sample that you pee, and you put that in the bottle, and you're done. That's 24 hours. You gotta know that. So a 24-hour urine for creatinine clearance. Question, Jessica, will this 24-hour urine for creatinine clearance with chronic kidney disease, will that be high or low in the lab when they test it? Will the creatinine clearance be high or low?
High.
Do you agree, Cup?
No.
You don't? Defend your part.
With chronic illness being,
This is chronic kidney disease.
yeah.
You can't disagree with that pretty little girl unless you know your shit. Otherwise, you gotta agree with her.
I can't really do
You disagree but have no defense. You plead, contest, no contest, right? That's what she got. Okay, Katie, what do you think?
it. I agree.
You agree? You said, fuck that, I agree. What you got, Kason?
I agree.
You agree? What you got, Ola?
I agree.
You do? You ain't got no defense either, huh? Pitiful. Okay, what you got, Rhonda? Come on, Rhonda, you can't slow on the uptake now. You gotta talk fast.
I gotta agree, I don't have to.
You gotta agree, no contest. You got no contest going on over here. I understand, baby. Rachel, what you got?
I'm gonna agree.
Cynthia, you ain't gonna argue?
I agree.
You don't wanna argue with me, Felicia?
No.
What you got, Sarah?
I disagree.
Oh, shit, Sarah in the house. What's going on?
Because you're not using that, so.
Woo! There you go, baby. That's what I'm talking about. You did not get rid of your creatinine. Remember, you gave me 8 functions of the kidney. It was supposed to excrete waste, creatinine, blood urea nitrogen, acid, uric acid. You didn't do it. So it's still in the body. It's not in the urine. The creatinine clearance is low with CKD. Gotta know it, y'all. Y'all gonna be all right. We're gonna get you together. But you gotta know this shit. In the urine itself, there ain't no damn creatinine. You ain't cleared shit. It's still in the body. Makes sense, don't it? But guess what, y'all? Peep this. When you draw the blood, it's high. Write it. Serum creatinine is high. Urine creatinine is low. Now, creatinine clearance, 85 to 135. Something you better know. Creatinine clearance is the most sensitive way to diagnose kidney failure, chronic kidney failure. 24-hour urine for creatinine clearance is the #1 way to diagnose CKD. Now be careful, because we got something called diagnose and we got something called screen. So let's do the screen. If we're screening for kidney failure, which should happen to every diabetic and did not happen with my father. In fact, when I look at his labs, I saw 11 years prior that he had this. Microalbuminuria. Microscopic amounts of albumin. What's albumin? Protein in his damn urine. Ain't nobody worked it up. So when you call me 11 years later, they told me I got kidney failure. They said my number is 19. What the fuck is you talking about? What? You don't just get kidney failure, Dad. What's up? That's what's up. Negligence. This was on his labs, his chart. I got access to all of it. And it said positive microalbuminuria his very first visit at that hospital for primary care. And no one bothered to use a 24-hour urine to diagnostically work it up. I need you not to be that nurse. I need you to be loud and proud and say, hey, when we dipped his urine this morning, it was positive for microalbuminuria. You want me to give him a 24-hour urine creatinine clearance bottle so he can start the process? Because that's what my nurses do. Wake up. We a team out here. What he don't catch, you better. Or you affect people like my dad. Now, so protein in your urine ain't never normal. It ain't never normal. It ain't never ignored. It should be followed up. I got somebody in my class now. They tried to tell her, you okay, baby, you cool. I said, oh, no, the hell you not. You gotta find your nephrologist quick. Protein in your urine is never normal. Started it in pregnancy, continued on, not cool. So she's being properly managed with a nephrologist. Protein in urine ain't never normal. That's some bullshit right there. Okay? All right, it's so simple to see. I mean, it's just a dip. My God, how ridiculous can it get? Okay? Now, so this lady, damn sure, is positive for microalbuminuria. Her creatinine clearance will be very low. She ain't cleared shit. Normal is 85 to 135. She ain't cleared shit. It's low. If you keep on pumping, you got up here at the top, kidney damage with normal or slightly higher glomerular filtration rate. It's almost like you got a calm before the storm. It's almost like your kidneys are trying extra hard to do the damn thing because something ain't right. That's how you gotta look at that. They still trying extra hard. So far so good? Okay, now go down a little bit, and this is where I lose my babies. If you're not careful, I lose you right here. It says decrease urinary concentration and nocturia. Is the specific gravity high or low? Shout it out now. High or low? Don't make me call your name. High or low, everybody? Think it's low? You won that one that time. I need you to associate concentration with specific gravity. If the concentration low, so is the specific gravity. So what color is the urine, everyone? Excellent. Now get this. The very first sign, make it plain in your notes. The very first sign of kidney failure is getting up at night to pee. Now before you call me, text me, Facebook me, and Instagram me, and tell me how your little ass got kidney failure, I'm gonna tell you to stop right now. I'm telling you, you got up more than once. Generally 3, 4, 5 times a night. I had a young lady that was sick. She was sitting on the little blue couches in the projects. She was like, well, wait a minute, Miss Shelly. I get up 5 times. She absolutely had kidney failure. I'm glad that we talked that day. So she got to the hospital, the doctor, her primary, and they sent her where she needed to be. And that early diagnosis is going to save her kidneys. As it turned out, she has lupus. So I need you to know, when you get up all night long peeing, that shit is crazy. Now, think about what you're doing. Maybe your crazy ass took some HCTZ or Lasix at night. That was stupid. Don't call me with that, please. Maybe you're the type of person that you drink a lot of water at work and you got off at 11. Okay, yeah, your little ass probably will get up at night. But I'm talking about the normal sister or brother who just runs through the day shift day and then comes home, eats the dinner, and does whatever. They could not, should not, will not, better not get up 3, 4, 5 times a night. That is not normal. Something is very wrong. Okay, so pay attention to your body because that's the first sign. We could have caught that, we could have saved this woman's kidneys. Now, I didn't know nothing about this microalbuminuria with my father, but my mama, I know about her kidneys. She got diagnosed around 30 years ago, at least, with stage 1 or 2. 30 years ago, you already know how I roll. So you know she ain't nowhere but about stage 3 early, right now, 30 years later, because I don't play. Once I know, oh, we're going to do things real different. My dad always had bananas on top of his refrigerator, drank orange juice every morning, among other things, because I didn't know. Watch your mom and your daddies. Watch them. It's your responsibility. Talk to them. This is very big. Why do you think there's a dialysis center on every fucking corner? Go to the hospital with your people. Watch what they're having done. Ask for the proper tests. I had no idea. He over there chilling like a villain, having a good time, traveling the world, retired. Kidneys are slowly dying. I had no idea. He ain't complaining. What is he? A man. They don't complain. Okay? All right? All right now. If you look at treatment of comorbid conditions, there we go. Diabetes, hypertension, what you gonna add? Lupus. There you go. Now remember everybody, something else I want you to know. Almost all of this shit, diabetes, hypertension, whatever, boils down to one big, huge, long, $4 word. And it starts with the A. What does your patient have? What word starts with the A that they all have if they got this? Say it with your chest, or don't say it at all. Atherosclerosis. Boom, excellent. What is that? You say that's a pork chop bacon sausage sandwich? Oh, okay. So that's a pork chop bacon sausage sandwich. Remember that? Remember the pork chop bacon sausage sandwich? So this is you with a clean artery in the newborn nursery. You was on some Similac or breast milk, your ass is cool. Now, this didn't look like this long, because your little ass went to college. And that's where you discovered wings and pizza. When you discovered wings and pizza and gorged on all of it, and especially right before finals, you are starting to develop a little bit of plaque around your inside of your artery. Do you agree? This was newborn nursery. This ain't your ass now. This was newborn nursery. Now, when you develop the plaque, the atherosclerosis, if you think of it, because this is what it feels like, I felt it, right? So it feels like lard in your artery, like grease, like hard butter in your artery, right? Okay. Now, so your ass in your 30s, it's you right now, in your 30s, late 20s, little 30s, you're starting to get a big old plaque on the side of it. You see it? It's real thick. It's going to be very solid. It's going to take the opening of the artery and make it what? Narrower, right? We're going to make it more narrow. And we're going to have, let's see, hold on. We're going to take that artery that you made smaller and require more pressure to push the blood through it. High blood pressure. Now, this happened from years of poor diet habits. You caught the elevator to 2. You drove your car down to the end of the driveway to check the mail. You rode around Walmart for a half hour looking for that spot by the door. You did that. Inactivity, right? Because what does activity do to a blood vessel? Dilate. Okay, so now we got sucky diet and we have no movement, sedentary lifestyle, so we stay basically doing nothing, okay? And what do we know? When you don't move, neither does your blood. So perfusion is not that great. If you got your ass up, start working out, you perfuse your kidneys and everything else much better. You feeling me yet? That's what this patient has, atherosclerosis. Okay, it's going to probably be one of many things they have, because just like atherosclerosis affected your kidneys, it also affects your heart. Just like it affects your heart and your kidneys, it makes diabetes worse. Diabetes makes it worse. They just love each other. They can have a stroke, which is your brain. All of this is affected by atherosclerosis. Every bit of those things are affected by atherosclerosis. Okay, so you just know that some things just kind of gradually happen to our body parts, right, y'all? Okay, so your little pork chop bacon sausage and Mr. Hero Mickey D's Burger King self for the listen. Now, what we got with this patient is we have to control